Hi everyone, welcome back to my channel. My name is Jessica, and for those of you who don't know me, I am a new grad registered nurse, and I'm also fairly new to YouTube. I created my very first YouTube video about 8 months ago, and I talked about my experience with the NCLEX, and I gave just a few tips and tricks on what helped me pass NCLEX. So if you are struggling passing NCLEX, or you're a nursing student, or a new graduate nurse that's ready to conquer this test, head on over to my channel and watch that video and let me know what you think. So for this video, I want to discuss nursing interviews and how to ace your nursing interviews. So in my experience, I actually did not start applying for jobs until after I graduated nursing school and until I passed my NCLEX. I know that some people are very focused on applying for jobs that last semester of nursing school or as they're studying for the test. I myself like to get focused on what I have to do in the moment. So during my last semester of nursing school, I was focusing on that last semester, and during my NCLEX experience, I was focusing on studying and passing that test. If you feel like you are stressed, or if you feel like you just have a lot on your plate, don't worry about applying for jobs. Just focus on taking things one day at a time. Finish nursing school, pass NCLEX, and then focus on finding a job. Believe me, there are jobs out there and you will get hired if you interview well. My first tip is to start building relationships while you're in school. So this means during your clinical rotations, during your lectures, during your labs, during your preceptorships or residencies or internships or externships. Build those relationships because those are all possibilities for you to get a job. Let me tell you, nurses are very resourceful in the nursing community, although it may seem like it's very large. A lot of nurses know each other, so building those relationships, connecting with people is really going to help you, get those letters of recommendation and land that dream job. Number 2, so when you are applying for a job, apply to every job that you can. I know some people after nursing school, they're very stuck on a certain specialty or area. I think that everybody should have an open mind after nursing school, and just really get your feet wet wherever you can. And be grateful for any opportunity that comes across, because if you don't take that opportunity, somebody else will come and take it for you. Just know that it's okay if you want to be an ER nurse and you get offered a tele or a med surg position. Just start somewhere. Again, build those relationships with your coworkers, and eventually, if you are still determined on being in another department, you'll eventually get there. Number 3 is actually very important. In order to make a good impression on your application, you need to make sure that your resume is up to date. And when I mean up to date, I mean don't include that ice cream shop position you had when you were 15 years old. Your nursing resume needs to be very nursing oriented. So this is where you should include your activities while you were in nursing school. If you were in a committee, or if you were a leader of a certain club, or if you held a certain position in your student nurses association or what have you, this is where you want to put your GPA. This is where you want to put your volunteering experiences that have to do with nursing, any certifications, BLS, ACLS, all those sorts of things help make your resume strong. Don't forget to include your clinical rotations, including the hours that you spend in each rotation. My tip number 4 for you is to include at least 1 to 2 letters of recommendation in your application. So this means clinical instructors, teachers that gave you, lectures, or lab instructors, or maybe your externship preceptor or your internship preceptor. Anybody that has watched you perform nursing skills as a student will be a strong candidate for a nursing letter of recommendation. So 1 to 2 I say is enough. I wouldn't go past 2, but some people do. But I think at least 1 and 2 at the most. I think 1 to 2 is a sweet spot. Number 5, prepare well for your interview. Preparing for the interview means doing research on the hospital or facility that you will be interviewing at. You really need to know where you are going to be working. If they hire you, you want to have an idea of what that company represents. And also in the interview, they will ask you about their organization. And when they ask you why you want to work for them, you really want to make sure that you can give them a solid answer. Make yourself stand out by, learning the CEO's name, learning their missions, learning their mission statement, their values, what they stand for, the procedures that they do, the specialties that they have. That sort of thing will really make you stand out. And also don't forget the name of the person who is interviewing you, and always refer to them as Miss, Johnson, or Miss, Simpson or whatever. So make sure that you know exactly who you are interviewing with. Tip number 7, practice interview questions. Don't go on Google and type in interview questions. No, you need to type in nursing interview questions and practice nursing specific interview questions. I can tell you that in the moment, it's really going to trip you out if you don't practice. Also, clinical scenarios. 2 out of 3 interviews that I had, I got asked case studies, and they were basic case studies, but it catches you off guard because they're kind of testing your knowledge, and they're very basic, but you're still so nervous and you want the job so bad that it causes you to not be as sharp. And let me tell you, when you're in an interview and you're nervous, and you're already foggy from all the other questions they've asked you, and you want this job so bad, you don't want to say the wrong things, all those things can cloud your judgment. So just practice different case studies, basic case studies. I would say, if I could give you an advice on which case scenarios to practice, I would practice, taking care of a septic patient, taking care of a patient that's bleeding, taking care of a patient that's having an MI, taking care of a patient with a stroke. Just very basic patient scenarios that you would most likely get in a med surg floor or in a critical situation. Also, use what you've learned in NCLEX. Use your delegation prioritization. So in those case studies, while you're studying, remember that you can always ask for help, and you can always delegate, and you can always you always have doctors and team leaders and supervisors that can help you. So don't feel like if they give you a case scenario that they expect you to take care of that patient by yourself, if that makes sense. Just take it with a grain of salt. They just want to make sure that you're safe and that they can trust you with their patients. Tip number 8, of course, dress to impress. This is not the time to wear your skinny jeans and tank tops. And this is not the time to wear your V-necks. Obviously, you all probably know this, but for me, I think for one of my interviews, I wore a long skirt with a blazer and just a plain pink top, black blazer, black skirt, and some, I think I wore either flats or very, very tiny heels. For another interview, I wore some slacks, my pink blazer, and a black top. I love the color pink, obviously, as you can tell, but I just like to add a little bit of color in my outfit just to not look so bland. But, just dress to impress. What I have for you is arrive early, and by early, I don't mean arrive an hour early. Nobody wants to have you waiting for an hour. At least 15 minutes early will help you get comfortable, and will help you analyze the room, get comfortable with the surroundings, and get comfortable with the temperature of the room, and it'll just help you kind of ease into things rather than just getting there rushed, and interviewing. So I think 15 to 10 minutes early is good enough for your interview. Number 9, ask questions. Interviewers love when the person they are interviewing asks questions. It is important to them for you to ask questions because it lets them kind of see how prepared you came. So if if they ask you have any questions, ask them genuinely, what you're wondering about the position, as far as, when will you have a decision, or, do you have any feedback for me, or how many people are you looking to hire? How do you usually, what kind of feedback do people have about this nursing position, or how do people get, just different questions about the job. I would stay away from questions about vacation time or questions about pay until they offer you the position. I wouldn't even ask about vacation time until, you're well accommodated in your position. You can always negotiate pay with HR, but I would not bring up pay in your interview, especially as a new grad. It puts a very bad taste in the interviewer's mouth. Just focus on getting the job before you discuss pay. And then lastly, number 10, make sure that you follow up with a thank you note or a thank you email. Look online and look up interview thank you notes or what have you, and it'll kind of give you an idea of how to write a quick but nice interview thank you letter. That's very important. If you can take it in person, that's the best. Just make sure that you follow up somehow, some way. All right, guys, that's all I have for you. If you have any other interview feedback, go ahead and leave them in the comments so that we can have kind of a dialogue on what has helped other people for nursing interviews. If you have any questions, you can leave them down below. I'll also leave you my Instagram, my Snapchat. I'll leave you my email just in case you want to email me any questions that you have. Again, don't forget to subscribe, like this video, and comment and let me know what you think. And also, I've been getting a lot of different questions on why I haven't been posting a video, or why I haven't posted a video since February or since January, I believe. I've just been so busy. I actually started my first nursing job in February, and it has been an experience, to say the least. So I've just been busy, getting adjusted in my new role, and just after nursing school, just really, spending time with my family and taking time for myself. So I am planning on making more videos and staying in touch with you guys more. So if you do have any questions, leave them in the comment section below, send me an email or a message on Instagram. I'll be happy to answer any of your questions. Until then, guys, have a good day. Love you guys. Bye.